The Philippine Nurses Association of Michigan is a professional nursing organization representing the Filipino American nurses in Michigan. And the Michigan chapter organization is a member of the Philippine Nurses Association of America. It is one of the oldest nursing organizations in the U.S. It was founded in October 14, 1972, as part of the formation of a Nurses Council in response to the plight of working H-1 visa nurses in Michigan. Now, PNM's vision is to be an organization responsive to the constituent needs and to be a force in the world arena of nursing. The mission of PNAM is to uphold and foster the positive image and welfare of its constituent members, to promote professional excellence and contribute to significant outcomes to healthcare and society through viability, vitality, and visibility in the communities. Currently, PNAM has 114 active members run by the executive board comprising of 10 officers, 8 board members, and 7 advisory council members. Members consist mainly of nurses who are also currently working, and some are also retired. PNAM is very much involved in promoting the health and well-being of the community, especially the Asian American community. Throughout the years, PNAM has conducted trainings and seminars, participated in research projects, wellness fairs, and other activities in collaboration with the academy, the hospitals, long-term care facilities, and other healthcare stakeholders.
The goal of our mini grant project is to create culturally and linguistically relevant tuberculosis and latent tuberculosis education, training, as well as community engagement resources and activities that resonate well with our local Filipino and other Asian American groups in Michigan. To achieve this goal, PNAM aims to, number one, provide education or training to clinical and non-clinical personnel on screening and testing of TB and LTBI, as well as current recommendation for course of treatments for these diseases. Secondly, our goal is also to raise awareness of TB and LTBI among the local Asian American communities who may be at risk of being affected by these diseases.
Maintain close relationship and collaboration with the Philippine American Cultural Center of Michigan, or PACCM, and also the Filipino American Community Council of Michigan, which is called the FILAMCO. These organizations provide us vital links and access to the local community, including networking and resources that help us to pursue and achieve our goals. For this mini grant, we have also connected with the TB control program of the Michigan Department of Health and Human Services to access local clinicians and experts to help us provide education on testing and treatment. We also work with the Eastern Michigan University and other academy here in Michigan.
PNAM has a long history of collaboration with the organizations that Reggie has mentioned, such as the PACCM and the PhilAmCo. Other than just the TB mini grant, the PNAM has worked with these organizations to provide health-focused fairs, socially relevant activities, or culturally relevant activities. With regards to our connection with the Michigan Health Department, it was a matter of our members reaching out to these services to see what resources we have available in the city department. Although the incidence of TB has decreased gradually over the years, it continues to affect many people in the US. In 2020, CDC says there's over 7,000 cases of TB reported. Of that number, 71% occurred among non-US born persons. Among those non-US born persons with a diagnosis of TB, up to 48% identified as Asians. In fact, the most frequently reported countries of birth among non-US born persons are Asian countries, including the Philippines. In Michigan, up to 4% of the entire population are Asians, which is among the largest in the Midwest. This makes it really important and particularly relevant to our local Filipino and Asian communities, with the goal of increasing awareness of TB and LTPI, and ultimately helping reverse this high incidence of the diseases in these populations.